Hello and good morning, good afternoon, or good evening from wherever you're watching me or listening to me from today. Welcome to Ask the Paediatrician Hour. This program is brought to you by Ask the Paediatricians Foundation. On Ask the Paediatricians Foundation, we are committed to reducing preventable deaths of children that are rooted in ignorance through our health education information online and through our free community medical outreaches to indigent communities. So I want to welcome everyone. For those of you who are watching on Ask the Pediatricians Foundation page and YouTube channel, you're welcome. And for those of you who are listening on the podcast, Ask Dr. Gbemi ATP podcast, you're warmly welcome. And for those of you who are watching on Fresh Waves Radio or listening to me on Fresh Waves Radio, you are also warmly welcome as well. Okay, so today I'm going to be talking about another important childhood disease, a killer disease that's responsible for deaths of many children, especially in sub-Saharan Africa. And today we're going to be talking about diarrhea disease. Yes, we're going to talk about diarrhea. Obviously, diarrhea is something very common. Many people are familiar with diarrhea. But are you aware that diarrhea is one of the leading causes of deaths of children below the age of 5? Yes, it's actually the second largest cause of death in children below the age of 5. And this is very sad because this is a disease that is largely preventable. And this is something that is very easily treated. And yet, despite that, a lot of children lose their lives every year due to diarrhea. In fact, in each year, we lose about 500,000 children below the age of 5, die from diarrhea. I mean, why should something so easily treatable and preventable lead to the deaths of 500,000 children every year? I mean, that is completely unacceptable. And so we're going to talk about diarrhea disease today. We can talk about how to prevent it. We talk about how to treat a child who has diarrhea. Now, let's start talking about some facts about diarrhea. In fact, about many children will have diarrhea, I think, their lifetime. Each year, according to the World Health Organization, about 1.7 billion cases of diarrhea occur every single year. 1.7 billion cases. And as I've told us earlier, about 500,000 of those children are going to die from diarrhea. So diarrhea is also, apart from killing children, it can also lead to malnutrition. And we know that malnutrition is underlying in 50% of cases of child deaths below the age of 5. So this is a very important topic. This is something that we need to know about. And so that is what I'm going to talk about today. So first, let's start by defining what is diarrhea. So when do you say a child has diarrhea? So diarrhea means the child is passing watery stools, and it's really when the child is passing frequent watery stools more than 3 times in a 24-hour period, then we say the child has diarrhea. It is very important for us to get that definition right, because sometimes I do get parents asking me, my child, maybe the child usually passes stool once a day. Now the child has passed two or 3 times, then the parents will say, oh, the child is stooling, and sometimes they misunderstood that to mean diarrhea. So as long as the child is passing normal, well-formed stools, that is not diarrhea. Whether the child passes 10 times a day or 20 times a day is irrelevant. As long as the child is passing normal stools, that is, the stools are well-formed, then it is not diarrhea. For a stool to be classified as diarrhea stool, it must be completely watery. And when we say watery, we mean something that would take the shape of a container, like it's something that you can pour like liquid. So if you put it in a container, it will take the shape of that container. That is watery stool. And that is very important because a lot of newborn babies, for example, and babies on exclusive breastfeeding, they don't pass, hard stools. They don't pass well-formed stool. They pass what we call semi-formed stools that look like a goosey soup. So you have some part of it that are solid, and you have some part of it that are liquid. And you will notice that they don't sink completely into the diaper or the nappies. Those are not diarrhea stools. Those are still normal stools for those age category. So for a stool to be diarrhea, number one, it must be watery. It must take the shape of the container in which it is put, or it must be very explosive stool. And then the child must have passed either 3 of those watery stools in a 24-hour period, or 1 very explosive stool. And so that is when we say the child has diarrhea. So I really want us to first of all understand what diarrhea looks like or what it means, so we don't get confused. So the fact that a child is passing frequent normal stool does not mean a child has diarrhea. And a lot of time mothers use word stooling. Usually that word doesn't often make much meaning to us. So we prefer you tell us the child is passing watery stools, and the child must have passed the watery stool at least 3 times in a 24-hour period before we say the child has diarrhea. And the stools that exclusive breastfed babies are passing that are not completely watery, not completely solid, we don't refer to that as diarrhea stools. Those are normal stools for babies on exclusive breastfeeding. Now, when a child has diarrhea, most of the time it's actually a symptom of an infection in the intestinal tract, that is the intestine. There are different things that can cause these infections. In fact, the most common of them are caused by viruses, things like rotavirus. That is why we always talk about rotavirus vaccine, because it's one of the commonest causes of diarrhea due to viruses in children. And there are other viruses that can also cause diarrhea. We also have things like bacteria or organisms like your cholera, like all those other Shigella. There are so many of them like that. They can also cause diarrhea. And also you can have some parasites, as well. They can cause diarrhea. So majority of diarrhea are due to what we call gastroenteritis. In other words, the child is having an infection in the intestinal tract, and that infection is what is causing the diarrhea. But that is not the only thing that can cause diarrhea in children. Sometimes children can also have diarrhea from eating contaminated food, so especially if the food is not well prepared, the hands were not washed, or the food has been kept for so long, and and germs have multiplied inside them, then you can have diarrhea from that. Or even water can be contaminated, which is one of the reasons we always talk about boiling water before we give it to children. And also sometimes if somebody else has diarrhea, the mother or the another child in the family, and they are not being careful with the hygiene, their hands are contaminated, they are not washing their hands, and they touch another person, that person can also through that get exposed to the same germ, and that can lead to diarrhea. So when we talk about diarrhea, because we know that most of the time diarrhea are due to infections, and most of these infections are from contaminated food and water. When we're talking about how to prevent diarrhea, you will see that most of it is about making sure that water are safe for drinking, and of course improving sanitation, hygiene, and that will help reduce diarrhea. Okay, now let's talk about what are the kind of diarrhea that we can have. So for the medical people, we talk about what we call acute watery diarrhea. Usually this is when children just pass those watery stools, and they can last for days, they can last for hours. And sometimes there's also the blood in the stool. So usually when there's blood in the stool of a diarrhea stool, we call it dysentery. So that is why when you tell us your child has diarrhea, we always want to ask, in addition to asking you how many times the child has passed the stools, whether the stools are watery, we want to know, is there blood in the stool? Because when there's blood in the stool, then it's what we call dysentery. It's still a form of diarrhea, but it's diarrhea with blood, and that is dysentery. And sometimes we have what we call persistent diarrhea. Persistent diarrhea is diarrhea that is lasting longer than 14 days. So most diarrhea should not last that long, but once you're having diarrhea for more than 2 weeks, we call it persistent diarrhea. And why is diarrhea important? And why is diarrhea killing our children? I always like to tell mothers that what kills children in diarrhea is not the stools they are passing, it's the complication of that diarrhea. And the one that is the most important is what we call dehydration. And you will notice why, you will know later why this is important, because when we're talking about the treatment of diarrhea, our goal is to actually prevent the deaths of children from diarrhea. And what is going to kill children who are having diarrhea are those complications, and those are the things we always try to address in terms of treatment. So the number one is dehydration. So when children pass watery stools, they are losing what we call a lot of water, and children can lose all their body water quickly, and it can become dehydrated. And how do you know a child is dehydrated? You see that the dehydration can be mild, moderate to severe. And so usually in mild dehydration, the child will just be thirsty, and they will just be, asking for more water. And of course, they are passing watery stools. But usually by the time they are going to moderate diarrhea, or what some people tend to call some dehydration, the child is becoming restless. You can see that their lips are dry, their eyes are sunken. If they are babies less than 1 year, the fontanelle, anterior fontanelle is sunken. They are very thirsty. They will drink very eagerly. Those are the phases of moderate or dehydration. And after a while, if we don't correct that dehydration, then the child is going to go ahead and have what we call severe dehydration. Then the children become so lethargic, they are no longer interested in drinking. Sometimes they can become unconscious. They can actually go into what we would describe as shock, and their lips are very dry and all that. Usually that is the phase just before a child will likely die from diarrhea. So we don't want children to have this dehydration from diarrhea. Apart from the dehydration children can have from diarrhea, they are losing what we call electrolytes. So when each time they are passing the stool, they are losing things like what we call potassium, sodium. These are electrolytes in the body, and they are very important for the bodies to function. And when they are being lost in the stools and they are not being replaced, then we will see the signs of those electrolytes deficiency in the child. Actually, things like potassium, if it is too low, then the heart will start slowing down and all that. So these are very important, or the tummy will also be distending as well. So these are all the complications that children can have from diarrhea. And so we've talked about why diarrhea is important. We've talked about the causes of diarrhea, the infections, and also the fact that diarrhea can actually occur in some other conditions. So some other conditions can cause diarrhea apart from the infection, like children who are malnourished can also have diarrhea. Children who have measles can also have diarrhea as part of the manifestation of diarrhea. Now, the most important thing actually is to treat diarrhea, because ideally diarrhea should not kill any child if we know what to do and we do it promptly. So the first thing we need to do is to replace what the child is losing. So the child is losing water, the child is losing electrolytes. So that is what we need to focus on. Unfortunately, most mothers tend to focus on the diarrhea itself, the stool, and they want to stop the stool, and they're looking for medication to stop the stool. So I always tell mothers, it is not those stools that are going to kill the child. Okay, it is what the loss, what the child is losing, that is going to cause any death of the child. So it's the water loss, it is the electrolyte losses. Those are the things that we need to replace. And we can easily replace that by giving children what we call ORS, oral rehydration solution. Oral rehydration solution is, so a child who is having diarrhea, we want the child to have ORS. We want to replace water. It's not just because when children have diarrhea, they're not just losing plain water. So that is why you cannot just say give them water to drink. It's okay to give them water to drink, but we need to give them the water that also have the electrolytes, so the salts, and that is why ORS is better than just the plain water. So ORS are available in the shops. Again, this is one of those things that you must have at home every time. See, and I know each time I come on this program, I'm always telling mothers. Last week I was telling you about fevers, and I was telling you about having your thermometer, having your paracetamol at home, because these are common things that children tend to have. So it's always good to be prepared, like the Boy Scouts would say. So as mothers, we have to be prepared. So diarrhea, we can see that billion of episodes, so it happens a lot. But so it should not kill the children if we know and we have the right thing to we know what to do, and we have the things with which to do them. So we must always have the ORS at home. But even if you don't have the ORS, there are things you have in your house that you can use as well to rehydrate the child. Everybody, I'm sure you have salt in your kitchen. I'm sure you have sugar in your kitchen. So as long as you have salt and sugar in your kitchen and you have water, then you can actually make your own ORS. We call it salt sugar solution, SSS, but it's similar as well. It's better than nothing, and it's better than plain water. So so when a child is having diarrhea, the most important thing is to be replacing that what the child is losing in terms of water, in terms of the electrolytes. So the ORS are available in the shops, they are available in the pharmacy stores. Just have them at home, and we have different brands. You have the plain brand, and you have the brand that are color, that are flavored. Okay, so with orange flavor and different flavor, because some children don't like the plain ORS. Some others say, oh, children don't like the plain ORS, but sometimes some children like juice and they like things like orange juice. So if you give them the flavored ORS, sometimes at least before they realize that it's not the orange juice, they would have at least taken some away. So always have your ORS at home, and it's very easy. Most of them, you open the sachet, you put it in like 1 liter of water, you shake it very well, and you give the child to drink, and just let them drink as much as they can. Usually we recommend that you finish that 1 bottle in 24 hours. If it is not finished in 24 hours, you have to make a fresh solution after 24 hours. So every day you make a fresh solution. But if you don't have the ORS sachet and you are just stuck at home, you can just get 5 cubes of sugar. For those of us, we are used to those cubes, the standard St. Louis cube of sugar. You can use 5 cubes of sugar, 1 teaspoon of salt. Level is not heaped, it's just a level teaspoon. Teaspoon is that smaller spoon, not the big one that we used to eat. That big one is the tablespoon. The smaller one is the teaspoon, and a level of it is enough. So you mix that 5 cubes of sugar and a level teaspoon of salt in about 600 mils of water. And this is most of us have all these bottles that are graduated, so you can know where it's 500 mils. For those in Nigeria, if you're not sure, if you boil 1 bag of pure water, that small piece of sachet of pure water is 500 mils. So you can use that. Or if you buy like all those bottled water, some of them are 1.5 liters, some of them are 1 liter. So you can, if you buy the 1.5, if you make it into half, that will give you like about 750 mils of water. So you have, of course, I must quickly say that the water you use to mix your ORS have to be clean water. Remember, it is the contaminated water that is causing ORS, or contaminated food. So when you want to make the ORS, whether it's the ORS that you bought in the store or the store sugar that you have in your kitchen, you must wash your hands, you must boil the water and let the water cool, and then you must make sure the measuring container and the cups you're going to measure it into, it must be washed and clean as well. So you wash all of them, and then you boil your water, let the water cool, and then you can now mix. If you have water that's already like distilled, bottled water, you don't need to boil them again. You can use them. But if you are not sure about those sorts of water, it's better to boil them. 5 minutes boiling is enough. You boil the water, you cool them, you measure it, and then you can now add, if it's a sachet, it is 1 liter of water with the 1 sachet of the ORS, the one that is available in the shops. If it is a salt sugar solution, you can use 5 cubes of sugar, 1 teaspoon, and add it to about 600 to 700 mils of water. If you don't know 600, 700 mils of water, if you have the all these soft drink bottles like Coca-Cola, the 35 cl. Okay, if you wash it thoroughly, you can use it to measure. If you measure 2 of it, that will be 700 mils. So, but if you have either a bottle or anything that is as that graduation, you can easily know how much is 500, 700 mils of water. If you don't have cube sugar, you can use your tablespoon and you use uh, 10 level tablespoons. So 10 level tablespoon or 5 cubes of sugar, see the same 1 level teaspoon of salt, and you mix it into 700 mils of water. So that is your salt sugar solution. So either you make the salt sugar solution or you make the ORS, then you can give the child. Usually you give them, they can drink it from a cup or you can give them from a spoon. And usually for us, mothers always say, how much quantity should I give? I will just give as much as the child wants. Because if you're in the hospital, there's a way we will tell you, depending on how dehydrated the child is and all that, we have a way of measuring those things. But for parents at home, I'll just say, just keep giving them as much as the child can drink. Each time the child passes tools, wash their hands and give them ORS. If they can finish the whole bottle in 24 hours, that would be lovely. The idea is that we don't want a child to be dehydrated. The most important thing to give a child who has diarrhea is ORS. Is the most important thing. Don't focus on getting drugs and all that. I'm going to tell us about the do's and don'ts of diarrhea very soon. But the most important thing is to replace what the child is losing. It is not to go after the virus or the bacteria or the parasite that is causing the diarrhea. Those are not the one that is the priority. The priority, what kills any child that dies from diarrhea, is the dehydration, is the electrolyte imbalance. So as long as you're giving them the whole RS, whether the stool is lasting for 5 days or it's lasting for 14 days, as long as the child is getting rehydrated, the child is not going to die. I can assure you of that. The child is not going to die as long as the child is being rehydrated, because what will kill the child from diarrhea is the dehydration and is the electrolyte losses. But when you are giving the ORS, you are replacing the water and those electrolytes that the child is losing. We prefer the ORS in the shop because it has more electrolytes. It has things like potassium, which your salt sugar does not have. Your salt sugar has only the sodium chloride. That is what is in your table salt. So it is more of the sodium and the chloride and the glucose from your sugar. But the one in the shop, they've added potassium, they've added bicarbonate. So there are other things that is getting. That's why I say you should have your what's it called? Your first aid box and your ORS sachet must always be there every time. See. Now, another thing that is important in treatment of diarrhea is what we call zinc. Zinc is a element, but it's available in tablets, and you have it as 10 milligram. You also have it as 20 milligram. These days, most of the our pharmacy shops selling the ORS sachet, they actually sell it together with the zinc. So it comes as a combination, it's a combo. The reason is because when you're also giving ORS, it is recommended that you also give oral zinc. Now, many parents always think the oral zinc is a treatment for the diarrhea or is to stop the diarrhea. No, the oral zinc is not to stop the diarrhea. What the oral zinc does is that the oral zinc is to help the intestine, because the diarrhea, remember we talk about, it's an infection of the intestine lining and all that. So the oral zinc job is to help the healing of that intestinal layer so that it can, and then of course that will help the diarrhea to stop. Because what happens is that when children are having diarrhea, I don't want to talk about all those medical pathogenesis and stuff, but just to explain a little bit so you understand why oral zinc is important, is that the virus or the product of the virus or the bacteria or the parasite, they attach to the intestinal layer. They actually make it either to produce more liquid or they destroy it so that the intestinal layer that normally is supposed to absorb liquid is not able to do it. So that means that is eventually why there's so much liquid getting out of the child and coming out as diarrhea. So usually most of the time, the way the body will eel is to replace the ones that either have been damaged or been stuck to and all that. So it will remove it, and a new lining will be formed so that that will now be able to absorb water, and of course the new lining will not be produce excessive liquid if that's the way the diarrhea infection was working before. And so what the zinc does in that case is actually to help with that healing process to be faster, okay, and also prevent a future episode of diarrhea. So this oral zinc is actually not just only for the current episode of the diarrhea, it's actually to prevent future episodes of diarrhea as well. And not even diarrhea, but pneumonia, because it also has to do with the lining, anything that has to do with the what we call mucosal layers and linings and all that. So oral zinc is very good for that. So you should give ORS and you should give oral zinc. That is all you need to give when it comes to treatment of diarrhea. And as long as you're doing that, the child will get better. Now, I always talk about the fact that we don't need to focus on the virus itself, which is what most parents want to focus on. They want to rush to give antibiotics and give other things. And some of these things parents give actually cause more problem for the child rather than deal with the diarrhea itself. So let me just quickly, while we're here talking about the treatment of diarrhea, let me talk about what are the do's and don'ts of diarrhea. I think that is the most important thing when it comes to diarrhea management in children, especially for parents. So the first thing, which I've already told us, is that we need to give fluids. We need to give fluids to the child because that is actually what is causing, that's actually what is going to cause a problem for the child. Is the loss of fluid. It's that dehydration that is going to cause a problem. So give fluids. And I know mothers will say, oh, the child doesn't like the ORS. The child doesn't like ORS, blah, blah, blah. It doesn't want to drink. Yes, I know some children don't like the taste of the ORS. They don't like the taste of the salt sugar solution. But there are alternative fluid you can give them. With the best option is ORS. The next best option is salt sugar solution. But if the child doesn't even want to drink those ones, give water. Always give water. You can always give water. You can also give things like coconut water. Okay, some children like that. You can also give things like your rice. If you cook rice with salt and that water on top of the rice before you don't let it dry up, let the water, that rice water on top, you can actually give the children as well. So there are other fluid you can give apart from the ORS for the children that don't like ORS. I encourage you to give them ORS. If the child doesn't like the plain ORS, you can give them the what's it called, the flavored one. There's flavor of orange and all that. Some children, they look at it, they look like, oh, it's like orange juice, and they want to go for it. So you can also give that as well. So and usually for children, like I said, if the child is less than 2 years, you can give them half a cup. Each time they pass Watery, to give them half a cup of the ORS. Between 2 to 10 years, you can give them a full cup to drink. And after 10 years, you can give them as much as they want. So just give fluids. Even plain water is fine. Even like what we call weak tea and all that, not the what they call it now, not the chocolate beverages. So I'm talking about the normal like green teas and all that. They are fine. So you can give other fluid, even plain water is fine to give to children. But there are some fluids you should not give. Okay, there are some things you should not give during this period. Don't give them carbonated soda drinks, all these Coke, Fanta, and the rest of them, or fruit juice. Those are not going to help with diarrhea, because most of them have what we call high osmolar load, so they are going to worsen your diarrhea, not make it better. So when I say give fluids, I'm talking of ORS, salt sugar solution, things like plain water, rice water, coconut water, even weak tea. Not the real tea, not beverage, not chocolate beverages. So you should give, but avoid things like soda water, fruit juices, and all that. They are going to make the diarrhea worse. So that's the first thing I want to talk about. And then I've talked about the second thing, the do's of diarrhea. Give oral sync. And I've talked to us about why oral sync is important. And a lot of parents always ask me, what's the dose? It's 10 to 20. It's okay. You can give 20 milligram. So it comes as tablets, so you're never going to find the syrup. A lot of mothers always ask me, I can't find the syrup of zinc. Yeah, you will never find the syrup. It's always come as tablet. What you need to do is to kind of make that zinc, you crush it. So you crush the tablet, just put it, I'm sure you know how to do it, like put in a little bit of paper and just crush it and it becomes like powder. And then you can put a little bit of water and give the child to drink, or you can put it in like things like yogurts or something that the child would drink, will be able to use to swallow it down. It's fine. So you can give that to children. Then is for younger children, usually by around the age of 2, you can give them 20 milligrams of the oral zinc. And oral zinc, usually you give for 10 to 14 days. And I know that most of the time the children have stopped having diarrhea before 10 days or 14 days. But please complete the dose of the oral zinc. You must give all the 10 or all the 14 tablets. The reason, like I told us earlier, is that it is not just about the current episode, it's also about preventing the future episode of diarrhea in that child. So we must give all of the uh, oral zinc tablets. Now, the third dose is that you must give food. Now, I know we grew up in a culture where parents believe that when a child have diarrhea, because you don't want them to pass through, then you should not give them food. So when you starve them, then this diarrhea will stop. Actually, is the most is the opposite of what you should be doing. That is what it is. Actually, what a child has diarrhea, that child needs to take food. In fact, the child actually need extra food, because apart from, I know I focus more on the water and the electrolyte the child is losing, but the child is actually also losing the calories through those diarrhea as well, things that would have been absorbed and give the child energy and all that. So when children have diarrhea, don't stop giving them food. You should give them food. Okay, you should give them food, but try and give them plain food that are not likely going to, don't give them things that are highly flavored, things that have too much of what we call osmolar load and all that. I'll give examples, but so just give them things they can like, things that are really a little bit plain. That's not the time to give a lot of milk. That's not the time to give things like beans. That's not the time to give things that like vegetables that will make the diarrhea worse. So just give them plain. If it's plain pap and things like that, you can give it to them. But please, you must always give food when children are having diarrhea. If the child is on breast milk, you must keep breastfeeding exclusively. And you must, that children with diarrhea, they may not have good appetite. So just give them the little that they can take and just keep giving. Even when the diarrhea have stopped and they are now eating, you must keep giving them extra meals, at least for another 1 or 2 weeks, so that they can regain all that they have lost. So it is very, very important that we do that. So 3 things you must always do when a child is having diarrhea. You must give them fluids, that is water, ORS, salt sugar solution, all of that. You must give them fluids. 2, you must give them oral zinc. 3, you must give them food. Okay, don't stop feeding a child who is having diarrhea. Feed them frequently, feed them extra meals even after diarrhea have stopped. Now, what are the things you should not do because I really want to focus on that, because I found that one of the reasons why our children actually die from diarrhea diseases is because we don't do the right thing. We actually do the wrong thing, because like I told us at the beginning, diarrhea is treatable, diarrhea is preventable. So no child should die from diarrhea disease. Okay, so what are those don'ts of diarrhea and that we do that we should never do? Number one, most diarrhea in children do not require drugs. Okay, I know parents always want drugs for diarrhea. Oh, doctor, what can I give? What can stop? I want something that will stop the diarrhea. So they've come to the pediatrician and we told you give ORS, oral zinc. And of course, parents think that the oral zinc is going to stop the diarrhea. So when the child is still passing diarrhea, they're like worried. So I always take time to explain to parents that I'm giving you the ORS and oral zinc not to stop the diarrhea. No, the diarrhea is going to stop by itself. I'm giving you to replace what the child is losing. It's very important for parents to understand why doctors give you medication. Sometimes we are giving you medication not because we want the condition to go away. There are different reasons, and it may be different from what you are thinking. So I always encourage my colleagues, always explain to your patients why you're giving them medication. So when I give you ORS and oral zinc, I always tell mothers, the ORS is not going to stop the diarrhea. The oral zinc is not going to stop the diarrhea. And truthfully, I'm not looking forward to stop the diarrhea. I want the diarrhea to stop by itself. And I will explain why that is important. Because usually the way, like I was trying to explain the mechanism, sometimes the way the disease or the infection is going to go away is for that diarrhea to continue until the new lining of the intestinal wall has been formed. So we need the old lining that has either the virus or the bacteria already attached to it to be removed completely. And that's only going to happen when the child is having that diarrhea. So it's taking out not just the diarrhea, but it's taking out the bacteria, the virus, or the parasite that is causing diarrhea in the stool with it. So it is okay. So we want all that to go out of the body system, because sometimes if you don't allow that to happen and you keep it stuck into the system, it gets out of the intestinal wall into the blood system, and the child can actually have a more severe illness. So something that will start as diarrhea may end up causing infection in the blood, may end up causing infection in the brain. So we don't mind the diarrhea. We know it will stop. Usually we know within 10 to 14 days. I always tell mothers diarrhea may take 10 to 14 days to stop. But the most important thing we need to do while we're waiting for diarrhea to stop by itself is to replace what the child is losing. We need to replace the water, we need to replace the electrolytes, we need to replace the energy and calories, and that is why we give fluid, oral zinc, and food. That is all we need to do. So now those drugs, we don't recommend drugs. Most diarrhea don't require drugs. Majority of diarrhea in children are caused by viruses, a few by bacteria, and some parasites. Majority of them do not need any medication. So please do not give tetracycline. Okay, those are the favorites. Don't give tetracycline. Tetracycline should not even be given to children below the age of 8 years. Okay, because tetracycline can cause the teeth of the children to become discolored and all that. So please do not give children tetracycline. Please do not give flagyl. That's another favorite of mothers. Everybody is like, I've seen mothers tell me, it's like they go to party these days, they even hand them flagyl. And I'm like, what? I mean, this is an antibiotic. Antibiotics should never be used without a doctor's prescription. And a lot of mothers just, I don't know where he started from, but people just think diarrhea, flagyl. I don't know where the connection comes from, but majority of diarrhea don't need any antibiotics. So no tetracycline, no flagyl. Don't give any of those antibiotics. Don't give drugs to stop the diarrhea. Okay, so people give things like Diastop, and the other ones that they give to adults. Please don't give our children those drugs. So all those things you must not give to children when they have diarrhea. No flagyl, no tetracycline, no Diastop, nothing else. Don't give children that. There are only very few instances that children will need antibiotic, and usually it is children that have what we call bloody diarrhea or dysentery. That's the only exception to drugs during diarrhea, and usually those children will have blood in the watery stool. If a child has blood in the watery, in the diarrhea stool, you need to take that child to the hospital. And when you get to the hospital, and then the doctor will prescribe appropriate antibiotics for the right duration. So if your child does not have blood in the stool, you have no business giving any drugs at all to your child. So don't give any of those things. And if the child even need the drugs, it has to be prescribed by a doctor as well. Now, these drugs, some of them have very horrible side effects, some of them have dangerous side effects. So, which is number one, they don't do much. Number two, they can cause major challenges for the children. Don't also give Septrin. That's another favorite of mothers and parents. Don't give all these drugs. They are not necessary. Okay. When your children need antibiotics or antimicrobial, the doctors we know, and the doctors are the one that will prescribe. I'm going to tell you when to go to the hospital. Another thing you should not do is the don'ts, that don't starve the children. So this is a very popular practice. Mother just believe that, okay, if you don't give the child food, the diarrhea will stop. Nothing is furthest from the truth. The diarrhea is not caused by food. The diarrhea is caused by an infection. Even if it is infection, is from a contaminated food. Now, what is causing the diarrhea is the virus or the bacteria or whatever. And so not giving other food is actually detrimental to the health of the child. And that is why diarrhea tends to lead to malnutrition. Diarrhea on its own can lead to malnutrition, but the fact that parents or caregivers now also withhold food from the children will also now cause the diarrhea will now cause the diarrhea to actually cause worse form of malnutrition. So please don't withhold food from children. Let them eat. Let them eat whatever they like to eat. And of course, I've told us, just avoid things like juices, things like things that can actually upset the child's stomach. I think that's the best way to put it. So give them more of plain, easier to eat, that kind of food around that period. And then when they are well, the diarrhea stops, then you can give them the full components of the diet, and even give them extra food. We always say give them extra food for another 1 to 2 weeks after the diarrhea episode, so that you can now they can regain all that they have lost during the episode of diarrhea. Now, finally, I talked about diarrhea. It looks like it's so simple, but sometimes there are certain situations where you need to take a child with diarrhea to the hospital. Again, this is also one of the reasons why children die from diarrhea, because sometimes parents just ignore diarrhea, like it's so small. I mean, I've seen somebody send me a message on Facebook like, my child had diarrhea like overnight, and by the following day the child is dead. Yeah, I mean, she was so distraught, and I was trying to encourage her and all that, and I was trying to say that children can lose all their body water so quickly, and they can die so quickly from dehydration. And that is why I keep emphasizing. I mean, if that's the only thing you get from today's presentation, then I think my job is done. Like, the most important thing in diarrhea is to replace that water that the child is losing, no matter how bad the diarrhea is, no matter how often it is. As long as you're replacing what the child is losing, then the child will be fine. So dehydration is also is a killer, so we must never allow it to happen, and giving ORS will do that. But there are other things we should watch out for in a child who is having diarrhea, so that the child does not those are the signs that we need to take the child to the hospital. Now, some children are passing diarrhea so frequently, like you can't even keep up, like you can barely keep up with. Okay, I told us diarrhea three of them in 24 hours. But if child is passing diarrhea like every minute, every second, you can barely keep up with giving them the ORS and replacing it. You may need to take the child to the hospital, because sometimes we just need to put the child on an IV. We set up a drip, and then we'll replace the water. So if you think this diarrhea is too much, is so frequent, and you are not even keeping up with rehydration, you need to take the child to the hospital. The next one is vomiting. Yeah, vomiting is so important, because mothers always ask me, what can we do with vomiting at home? There's nothing you can do. that we don't have anything to stop vomiting, I don't recommend. I know many of you will go and give things like Phenergan and all that. Please don't. Those drugs are dangerous. I've seen a child collapse and died from Phenergan. Yeah, some children can have very, what we call, idiosyncratic, very horrible reaction to those medication. So I don't touch Phenergan with a long pole, but I'm always so scared when I see mother just use it like it's an paracetamol. Please don't do that. It can be very dangerous. So if a child is vomiting and is not able to tolerate the ORS, that child needs to be taken to the hospital, because the only alternative we have is to set up an IV line and give the child the ORS through the veins. So that is all we can do. So if a child is having diarrhea, you've given the ORS, the child is not able to keep it down, the child is also vomiting along with the diarrhea, the child is not able to drink ORS, the child is vomiting the ORS, that child needs to go to the hospital so that the doctors can rehydrate the child. And that's what we're still going to do at the hospital, is about rehydrating the child. But this time around, we're not going to do it through the mouth. Since the child is vomiting, we're going to do it through the veins. Number two, if the child is showing signs of dehydration, so child has diarrhea, you've been giving ORS, but the child is still very thirsty. The child is becoming restless. So that sign of what we call complication is already setting. Remember what I was saying earlier is that our goal in diarrhea is to prevent dehydration and shock, because those are the things that will kill the child. So if the child is now already showing you signs and you're already giving ORS, what I would normally say, give the ORS, give a lot, and the child is still showing signs of dehydration, the child is thirsty, the child is becoming restless, the child is changing, they are no longer with you, they are losing their consciousness or things like that. That is complication already setting in. That child needs to be taken to the hospital immediately. If a child is having fever with the diarrhea, so sometimes most children, when they have diarrhea, it's just diarrhea and there's no fever, the child is otherwise well, the child is even playing, the child is eating, drinking the ORS despite the diarrhea. Those ones you can manage at home. But if a child is actually ill with the diarrhea, they are having fever, they are having the vomiting, you need to bring them to the hospital, because sometimes diarrhea may just be one of the symptoms of another illness. So, and with fever and all that, so we need to see the child. We need to know, is it malaria? Is it an infection here and there? So we need to do proper evaluation of that child. So if a child who is having diarrhea and having high fever with it, you need to bring the child to the hospital. Some children may have mild fever and they are still taking their ORS. You may just watch, give them paracetamol, give them ORS and watch. But if your child is really very high fever, is having very high fever, then you really need to bring that child to the hospital. That is another thing we need to do. If there's blood in the stool, okay, so I already told us that diarrhea with blood, that is what we call dysentery. That is a very serious form of diarrhea. We need to, because usually those kind of diarrhea, we need to treat it with antibiotics. That is not going to just be ORS only. So because we need antibiotics, then it's better you bring that child to the hospital. Please do not self-medicate with antibiotics. It's this is what we call antibiotic resistance. So, and what antibiotic resistance does is that when your child eventually needs that particular antibiotic, it won't work. And it can be a very dangerous place to be, because a lot of mothers, especially those of us in Africa, where we have access to just go and buy drugs in the pharmacy by ourselves without a prescription, we abuse antibiotics. I mean, I see mother talking to me about using Zena, using Augmentin. Those are very powerful antibiotics. Those are antibiotics that I, as a pediatrician, I'm not going to prescribe as the first antibiotic for your child, even myself as a pediatrician. But mothers use them like they're pure water. No. And the challenge with that, by the time if anything happens and that child needs those antibiotics, they may not work for the child. And then we don't have like inexhaustible list of antibiotics. So after a while, if you don't have anything to be, it can be fatal when there's no drug that your child will react to or will respond to. So please do not just form this habit of giving antibiotics to your children for absolutely no reason. Any small cough, you go and buy antibiotics. Any small diarrhea, go and buy antibiotics. You are causing antibiotic resistance, and it can be very dangerous. I think I'm going to come back one day and just talk about antibiotic misuse and abuse, or maybe with a pharmacist. It's a very, very dangerous thing, and it's something I see a lot for us in Nigeria and Africa. We need to stop it. So please, if your child has blood in the stool, take the child to the hospital. Don't use those antibiotics until it has been prescribed, because there's a right amount to give the child, which mothers don't know. Everybody is not 5 meals of everything. No, in pediatrics, we give antibiotics by the weight of the child. There's a right duration to give antibiotics. Most mothers don't know that. They just give the antibiotics until the illness has stopped, and then they stop, which is always not the right. Sometimes even when the illness has stopped, you still need to complete your dose of antibiotics. If it's 5 days, if it's 7 days, you have to complete it, or else you are causing antibiotic resistance. So it's very, very important that such cases are taken to the hospital and for the doctors to do the right thing. All right. And if the child is not getting better, or the child is not able to eat, the child is not able to drink, as parents, I know we're all very sensible. We can just see that this child is not responding to all our first aid and all that. Then we have to take the child to the hospital. So you take the child to the hospital, and then the doctors, they will do the right thing, evaluate the child, treat the child, and the child will get better. Okay, so I've talked about the do's of diarrhea. I've talked about the don'ts of diarrhea. I think the most important thing as I round up is to talk about prevention of diarrhea. Is to talk about the prevention of diarrhea. Now, the most important thing is drinking water has to be safe drinking water. So I know there are all of us get our water differently. Some of us have treated tap water sent to us. Good. If you know, please boil your water. It's very easy to make water safe for drinking. Boil it. You can boil for 5 minutes. If you don't want to be boiling water, because obviously gas and it's expensive now, you can use what we call the water chemical treatment for water. So there are things like what we call water guard and the rest of them like that you can use with your water. When you put it inside your water, it will make them safe for drinking. So just make sure you follow the instruction on how to use those chemicals and all that. So the water for drinking, and especially for those of us in Nigeria where we buy pure water, most of those water are not pure at all. They are dirty. I think some people have done research. They just went to all those pure water, take each of the samples, and they then send them to the lab and to what we call do a culture on them, and they were all growing all sorts of dangerous bacteria. So please don't say, "Oh, I'm buying pure water." Most of them, you don't know where they are buying them. I mean, we've seen all the news, and we've seen where people just sit down in one uncompleted, very dirty environment, and they are just bottling those water. People with no conscience, and even some of the brands that you think they are good brands, some of them, people are pirating their brands and using their bottles to bottle this water that are not being purified and not clean. So be on the safe side. Either you are sure where you're getting your water source from, or you boil your water, or use water guard. It's very, very important. Another thing we need to do, hand washing. We must wash our hands off. I think we have learned a lot about hand washing during coronavirus epidemic. At least that's one of the good things that coronavirus has taught all of us about hand washing. Sanitation is important. We need to remember to wash our hands with soap and water before we make our children's food, after making the children's food, before we feed them, after feeding them, wash your hands with water. When we change children's diaper, let's wash our hands with soap and water. When our children are going to nursery and all that, let's make sure that they are being supported, because most of them cannot clean up after themselves properly. So the schools, they need to remind the children, if you wash your hands, so they must wash their hands properly. Another way to prevent diarrhea is what we call sanitation. So a lot of people just believe that baby stools are as if there's nothing wrong with them, as if they cannot cause infection. So they are not very careful the way they dispose them. Some children will finish, doing a poo, and they even play with it and mothers are not seem to be bothered. That is actually wrong. And some mothers even believe that children can actually play with sand and they should eat sand, and that is the only way. That is, it's like it's part of it's in the constitution. No, that is not true. So please, let's maintain good hygiene. Let's keep the environment clean. Let's make sure children don't touch waste products. Let's make sure we wash their hands. As we're washing our own hands, we're washing the hands of the children, because it's when they touch all this stuff, put it in their mouth, that's how they introduce the germs. It is not the teething. You know, some of you that believe diarrhea is from teething. It's not. It is those germs that children are introducing to themselves that will cause diarrhea and all that. Exclusive breastfeeding is part of ways of preventing diarrhea. I know most people say, "Oh, the pediatrician cannot talk without talking about exclusive breastfeeding." Actually, it is true, because exclusive breastfeeding also will keep children below 6 months from having diarrhea. When mothers tell me my less than 6 month old is having diarrhea, I always ask them, are you doing exclusive breastfeeding? Are you giving water? Because most mothers don't think that exclusive breastfeeding means just exclusive breastfeeding. Some people give water and they will say call it exclusive breastfeeding, which is not true. Exclusive breastfeeding is exclusive breastfeeding, breast milk only and only, nothing else. No water, nothing else. So exclusive breastfeeding, very important to make sure that our for the first 6 months of life, children are prevented from having diarrhea. Of course, vaccine, we have the rotavirus vaccine. It also prevents diarrhea in children. So some of you always ask me, should I take rotavirus? Should I not take rotavirus? Please take it. It can actually prevent diarrhea in children, especially children between the age of 6 to 11 months. At that age, when they are prone to having diarrhea, that most of you always think is teething, it's actually rotavirus. And if you take rotavirus vaccine, it will prevent it. And I'm happy that rotavirus vaccine is now part of our, for those of us in Nigeria, it's now part of our Nigerian program on immunization. I know some of you struggle to get it, maybe because it's not available, but I'm sure the government is working hard to make sure it's available. But if it's not available and you have to pay for it, it's a good investment to do. So please pay and get the rotavirus vaccine. But more important, hygiene. Let's make sure personal hygiene, hand hygiene, safe drinking water, safe preparation of food. And actually say don't keep leftover food for children. If you have to keep it, you have to store it properly, and you have to make sure you warm it properly and cook it thoroughly so that all the germs are killed off. And don't use bottle. That's another way children get diarrhea. Don't bottle feed them, whether it is complimentary. If you don't put it through bottle, most of those bottles are great source of germs that can lead to diarrhea. So if we follow some of these principles, our children will be protected from having diarrhea. All right. So thank you so much for joining me today. So I've been talking to us about diarrhea diseases in children. It is a killer disease in children. 500,000 children die every year below the age of 5 from diarrhea. However, diarrhea is preventable and it's treatable. So the most important thing you need to do for a child who is having diarrhea is to replace the water and the salt, the electrolyte they are losing. So rehydration is the most important thing, because what kills children from diarrhea is not the stool, is the dehydration. And I hope now all of us know what to do. If you have any questions for me, feel free to send it to us on WhatsApp. That's a WhatsApp number. For those of you who are watching, and for those of you who are listening, it is +234 905 691 6818. +234 905 691 6818. And or you can email me at Dr. Gbemisola at askthepaediatricians.com, and I'm happy to answer your question. Remember, you can also post your questions on our Facebook groups on Mondays to Saturday, and we are happy to answer them. Or you can, if you have any questions or any topics you think you want us to address on the Fresh Wave Radio or on the podcast, feel free to also send it through the WhatsApp or through email, and I will make sure that we address them with time. So thank you so much, everyone, for listening. Remember to share the video, share the podcast, and invite friends and family to follow us on all our social media handles so that you can learn more about how to keep our children safe and healthy, and to keep them to make sure that they live and they do not die from all these killer childhood diseases. Thank you so much, everyone, for watching. And I want to say bye from me. See you again next time. Bye.